I saw an interview, actually, Stephen Crowder, a Canadian comedian, had a mortician on. Did you happen to see that interview?
I'm not familiar with that one.
Well, he had a mortician on, and the mortician was reporting that he is now seeing these huge growths. He actually showed them. He has captured a number of them. These huge growths from the arteries of recently deceased people. They are apparently anomalous in his experience. He hasn't seen these things before. They superficially might be called clots, but they are chemically not similar to what a normal. Not only is the structure much larger. In fact, he tells the story that he thought the pump that perfuses corpses with formaldehyde was broken because it couldn't push past these clots. And when he went after them, he got these gargantuan alien-looking things out of people's arteries. I was wondering if you have heard anything like this from the medical side.
No, Dr. Drew actually mentioned this as well to me, and I've seen a few of these images, but and they look very extraordinary. Nothing like I've seen before. I haven't personally had anyone contact me or any pathologist to suggest to me that they've seen anything like this. It doesn't mean it's not happening. But yeah, I mean, this is, again, a novel technology, and we don't know exactly all the kind of things it's doing within the body. And certainly clotting abnormalities themselves, and it may be these are unusual, they have unusual appearance, are one of the most common serious adverse events from the vaccine. So Joseph Freeman, who's a lead author on that paper, published in Vaccine, where they did a reanalysis and found this 1 in 800 figure. He told me that actually within that 1 in 800 figure, 40%, the most common serious adverse event, was related to clotting. So including things like heart attack, strokes, pulmonary emboli. So that's an interesting, what you shared with me probably fits with that. But I don't know. Yeah, I wouldn't be able to comment on the specific pathology.
Yeah. You raise another issue, though. I don't know anything about it professionally, but these pseudoclots, or whatever they are, or maybe they are clots, look to like they must have accumulated over a very long period of time. And I'd be very curious to know if that's true, whether they show up on scans, this kind of thing. But the other issue is, another little place where the pharma game alters our perception is that there are claims about, what is the commonality of myocarditis following a second dose of Pfizer, for example? Well, that is not a good question, because myocarditis is diagnosed at some threshold, right? Presumably, there's lots of subclinical myocarditis. Maybe there's even undetectable myocarditis. And this is not liable to be cost-free in terms of your longevity, for example, right? So if you have a little myocarditis, not enough to cause you to seek medical attention, and then at some point in the future, you push your system beyond some usual limit, maybe that turns into a critical failure and won't be attributed to the cause from the so-called vaccines. And so I guess I'm wondering, to what extent do you think our crude measurement tools are missing damage that will actually be significant enough to alter longevity?
I think that they are missing them to a large degree, Brett. So I've managed many people in the community who would not have had a formal diagnosis of myocarditis because of the vaccine, because they developed symptoms in the community that they didn't merit as being severe enough to be hospitalized. But clinically, from the history, you could say it probably was myopericarditis, where you get involvement of the outer layer of the heart as well, and that gives people chest pain. And they were very classic. One of my patients, a lady in her 50s, actually developed within 2 months of having the vaccine, very fit and well, good, no problems in the background, shortness of breath. And then an echocardiogram, an ultrasound scan of the heart, revealed that her heart muscle pump function was severely impaired. And again, from the history, the most likely cause was the vaccine. She, again, wasn't admitted to hospital. So I suspect there's probably quite a lot of people out there that are, who are vaccine damaged maybe don't know it, or certainly aren't coming under the statistics in the published literature of, say, 1 in 2,700. I think that's the highest figure reported in young males of prevalence of myocarditis after the vaccine, but that's specifically people who are hospitalized. So you're right, it's probably a lot of people in the community who are having vaccine damage as well. And again, how this plays out in the long term, we really don't know. But if there is any scar in the myocardium, which often happens after myocarditis, then that could be a potential substrate for rhythm disorders moving forward. I think one of the other things that's worth mentioning as well, Brett, in terms of, I try, first and foremost, me as a doctor, as a physician, is I want to be the best possible doctor I can be for my patient. And there are two crucial components to being a good doctor or getting the best patient outcomes. One is your history taking, your clinical history taking, and the other is empathy. And the reason why history taking is important is that 80% of your diagnoses comes from the discussion with the patient if you are a good doctor. A good doctor doesn't rely on tests or go to tests first. A good doctor makes his diagnosis predominantly, or likely diagnosis, from the discussion. And that's really how, and that concept, interestingly, a little anecdote for you here. My alma mater is the University of Edinburgh. The University of Edinburgh Medical School was also well known also because one of its medical students who became a doctor was Sir Arthur Conan Doyle, who is the author of Sherlock Holmes. And are you aware of the link between Sherlock Holmes and medicine, Brett? Do you know about this story?
I don't think so.
So Sherlock Holmes's byline was this, and this is how he solved his murder mysteries, his, who perpetrated crimes. And I say this is how we make diagnosis. When you've eliminated the impossible, whatever remains, however improbable, must be true. And if you apply that to medical practice, you'll never miss a diagnosis. The problem we've got, certainly in relation to the COVID vaccine, is that doctors are not even conceiving of the possibility that many of these problems are related to the vaccine because industry has hidden that data. And therefore, it's not part of the differential diagnosis. Once I became aware of these possibilities from a WHO, World Health Organization, endorsed list of all these potential side effects, which again I list in my paper, then you open your mind up to the possibility that the vaccine could be a cause because you've excluded other possible causes. So many people who are being gaslighted or being told it can't be the vaccine, but they're being told, I don't have any explanation for why you with no risk factors suddenly had a heart attack, or why you've not had a history of a viral infection, you've suddenly presented with heart failure. The common denominator through the history often is the vaccine, and that's how you make the diagnosis.
A couple things in there worthy of comment. One is the rush to vaccinate everybody complicates this. If they had succeeded in vaccinating everybody, then it obscures part of the pattern because doctors wouldn't be able to detect some difference between their vaccinated and unvaccinated patients.